Good. Thank you for joining us.
Well, thank you for this opportunity.
Of course. So let me go ahead and get started. For those of you who know, I am Orlando. My name is Orlando Machuca Jr. My pronouns are he, him, and his. I am a social media influencer employee at the Whitman-Walker Health. For those of you that don't know, during the past few months, Whitman-Walker's community health department has expanded its outreach to help social media platform. We cover various topics on HIV, STIs, sexual health practices, and access to care, social detriments of health, and general public health interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage our sexual, personal, and mental health. The community health team is here to help educate and support you. Today, we're joined by a special guest from our dental department to discuss oral health tips and access to dental services with Whitman-Walker during COVID-19. Welcome, Dr. Johnson.
Thank you very much. This is Jim Johnson from the dental department. My pronouns are he, him, his, and I'm delighted to have this opportunity to talk with you. I've been doing fairly well during the shutdown, but I am very anxious to get back to the clinic and see our patients, see our team, and essentially my friends.
Yeah, just like me, I miss all the interactions with people and being able to, enjoy time with other human beings. All right, so let's get started. First question we have today, Dr. Johnson. What dental services did Whitman-Walker Health provide before coronavirus 19?
Yeah, the dental clinic handles just about everything that is done in a private dental practice that is run by general practitioners. We do the usual things with the x-rays, with diagnosis, with treatment planning, and then we do the treatment. After the treatment plan was agreed to by the patient, then we went ahead and we were able to do crowns, root canals, extractions, dentures. We did partial dentures and full dentures, and just about anything that you can get in a normal general dental office. Our wonderful hygienists are the first to see the new patients, and they take the patient back, get them oriented a bit, and then take the necessary x-rays and do an evaluation of the gum and the bone. And we're very fortunate to have 4 terrific, well-trained hygienists at Whitman-Walker Health. In addition to their diplomas and required training, they 2 of them out of the 4 have master's degrees, and 1 is finishing up a master's degree. So we're very happy with them. When they see the patient and get the x-rays, then they will invite a dentist to come in and to meet with the patient and to work up a treatment plan, which is done in cooperation with the patient, trying to figure out what they want to do and giving them the options that they have. So our goal always is to threefold. 1, we want to make sure that the patient is free of pain. We want to make sure that they can chew without any discomfort, and that they can do it efficiently, and they can look as good as possible.
Of course.
So we have 3 dentists. Dr. Patrick Hughes is the head of the department, and he directs us with a clear vision but a gentle hand, and we appreciate that a lot. Dr. Carrie Hiron is also a staff dentist along with me. And between the 3 of us, we have 90 years of experience as dentists.
Oh, wow.
So we've seen a couple of things in our lifetime. We consult with each other about the best way to proceed with the treatment plan. Also, if there's a difficult dental problem, we'll talk it over. And it's nice to have someone to run these things by and just come up with different ideas. Each dentist has the help and the support of 5 registered dental assistants. they do a lot of things. Their two most important things are to coordinate the sterilization protocols that must go on, and they do that. And the other is that they make it easier for us to get the patient in, to do the treatment and get the patient out, and they've had their mouth open just for a minimum amount of time.
Okay.
Life would be very difficult for a dentist without the assistance.
I'm sure.
And we have some really good ones.
I'm sure. Perfect. Now, in your expertise, how has COVID-19 altered dental services with Whitman-Walker?
It has been dramatic. We were working on March 17th, and on March 18th we weren't. But there has always been a dentist there at the office to help the patients. And so patients have called with pain, with broken teeth, with broken dentures and crowns out, and just about anything you can imagine. The dentist on call has the medical and dental records, and so is able to see maybe what's going on and then prescribe the right things, even if it's for pain or how to get a crown back on or how to just survive the time at that time.
Okay. And how can patients take care of their teeth at home?
That's a great question. The first thing to do is brush with a soft brush. Sometimes we think that harder is better, but the soft brush will let us clean the plaque off and yet be gentle with the gum. And our hygienists try to evaluate how our home care is and make suggestions as to how to do it better. And if you've been a patient there and had your teeth cleaned, then the hygienist has gone over that with you. Even this dentist is not immune to the welcome instructions of the hygienist. One time I was getting my teeth cleaned by the hygienist, and she said, "Do you want me to talk about or say anything about the plaque that's on the back of your molars?" And so I was a grateful learner. So I started working on that better. There's a couple of ideas though. Use a soft brush to begin with, but brush every time you eat something. Some of our patients come in and they sort of proudly say, I've brushed my teeth twice a day, morning and night. And we applaud that because it's more than what some people do.
Right.
But we also are recommending that anytime you eat anything, you brush and floss. So it makes you think, really, do you want to have that snack? Because even if it's just a snack, you're going to have to do that. There is a link to the American Dental Association that will give more detailed information about how you can do that. And the link is going to be up on your screen.
Perfect, perfect. Thank
All right.
you. Sure. What can patients do now with the dental emergency?
Yeah, we still have a dentist on call, taking your calls. Excuse me, and you can call the clinic and you use the number 202-745-6170, and you will be able to talk to the dentist. He has your chart, your health history, and we'll try to get you a safe and effective solution. When we do open, we will be dealing with these emergencies first before we start anything else.
Okay, sounds good. How will the pandemic change the way you practice?
It is going to change it in visible ways. You'll first notice when you come for your appointment is that you're going to be stopped in the hallway and your temperature will be taken with a non-touch thermometer. If there is no fever, then they will get more of a health history, which doesn't take very long. And assuming that's just fine, then they'll send you on down to the dental clinic. If you are feeling badly, or you think you're sick, or you think you have the COVID-19, call your primary care physician and he will direct you as to what to do about that. Don't come into the dental clinic and don't even come to the clinic. but talk to your physician first. When you come, we would ask that you wear a mask and that you honor the 6 feet between people. If you can, come by yourself. Don't bring family or friends, because they're going to have to go through the same procedure that you do. And there's a limited amount of space down in the dental clinic. When you get to the clinic, you'll notice a couple of things. One, that the chairs are spaced out 6 feet to keep you at a safe distance from your fellow patients. You'll notice also that there is a plastic shield in front of the receptionist, and we ask you to honor the 6 feet distance there and just talk with them through that. When the assistant calls you back, she will be already dressed in her personal protective equipment, including the gown, gloves, a face mask, and probably a plastic face guard. And she'll get you seated as efficiently as she can. And then the dentist will come in. He or they will be scrubbed, gloves on, gown, face mask, and a plastic face guard. We used to be able to sit down and chat for a while, shake hands, and we still want it to be a friendly endeavor for all of us, but it's going to be a little bit different than it has been. And when we open, and I hope it's soon, but I don't have an answer for you as to when that's going to be, we will be taking care of the emergencies that we've had and try to get the patients comfortable and get the crowns put back in or get a filling done. But we're only going to do what is really necessary until we feel like it's safe to go on and do other things.
Okay. So in other words, people, be patient. Remember, emergencies comes first, and everything is still as playing by ear. We're not sure how things are going to work in the future, but make sure you're still 6 feet apart. You know, making sure if you're sick, stay home. Call your primary doctors. You can always call the number and ask questions if you're not sure. But we're definitely here to help, and we're definitely here to answer questions. You can follow Whitman-Walker on Instagram, Facebook, Twitter. You can give us a call. Thank you so much, Dr. Johnson. Is there anything else you want to add today?
No, but thank you very much for the time, and I look forward to seeing our patients.
Perfect. Thank you so much for having your first time on a live Instagram today with us, Dr. Johnson.
My pleasure. Thanks.
Anytime. Let's see if there's any questions on here. And again, if you guys have any questions, just send us a message on Whitman-Walker, Instagram, Facebook, or live. And I think we're good. We just have information from the team that's posting for us. No specific questions. And again, this video will be available later. So if you missed it, just go to Whitman-Walker page. It'll also be on my Instagram TV for those of you that have questions. Thank you so much, Whitman-Walker. Thank you so much, Dr. Johnson. We'll talk to you guys soon.
Thanks, Orlando. Bye now.